You're listening to 106.9 TuneFM here on the home of UNE's student-powered radio. My name is Ash Taylor and I'm here with Anjali Muller, Ph.D. student from Te Punaha Matatini and Massey University, joining us all the way from New Zealand. Thank you so much for joining us.
No worries. It's nice to have a chat.
It is an absolute pleasure to have you on, and just to get us started, can you tell our listeners just a little bit about yourself and how you came to work in this space of medical research and what it is that you focus on?
So I'm a PhD student and I'm exploring doing research in a different way, so a way that prioritises lived experiences as being a form of expert knowledge. And so I've been doing that through a case study on women's health here in New Zealand, and we've been involving women from all walks of life all across New Zealand in conversations about women's health with an idea to bring together research questions that have been created with these women that are a priority to them. So rather than health professionals or academics creating the research questions, actually asking the people who will hopefully benefit from that research what they want to know.
For sure, yeah. I feel like I can probably take a good guess at what got you interested in doing this research, but to hear it in your own words, what drove you to undertake this research?
Well, I've had a lot of my own health experiences across my lifetime, and obviously I've talked with friends and stuff and know that women have had quite a few not great experiences in the health system. And so, always been interested in learning more and improving that. And I've also kind of come from a not-for-profit background, so really keen on engaging with communities and building those connections and relationships and doing things where people are at the heart of things.
Fantastic. Yeah, I think that it's such a wonderful and important part of research that I think sometimes people forget to include, and they forget to consider that, we are as individuals experts in things. I come from a chronic illness background myself, and we are the expert in our own life and experiences. And, as you say, women are the experts in their own life and their own experiences. And unfortunately, all too often, as you're well aware, their voices just aren't listened to by doctors and other medical professionals, which I suppose, this brings us to this study so it comes out of the University of New South Wales, which is looking at repairing the gaps in women's health research. And you're actually one of the experts who have reacted to this study through CIMEX. So what is your take on the study and what it found?
I was really interested in it. It's really demonstrating that to get better women's health research, it's really complex, and that it has been avoided in the past because of that complexity. And actually, instead of just going, it's too hard, we really need to figure out how to do it and how to do it well. They made a point about needing to be mindful that it doesn't reinforce the stereotypes and the discrimination that already exists. And that is not just for women, but for trans, non-binary, intersex, and all the other sex differences and gender differences that are around. And so we really need to take care with how we're doing that research and to honour that complexity and do it well, rather than just going, oh, it's too hard. Let's, all those pesky hormones doing stuff. Let's not bother. We'll just study the default man, which is what's kind of happened for decades, and now it's starting to change. So, I really liked the approach on how that needs to be considered, and they made a good point that it needs to be included in policy. If it was going to improve of its own accord, it would have happened by now, and it hasn't. So we need to make real considered, intentional efforts to improve that research.
For sure, yeah. Why do you think it is that so many people in the research space just kind of go, oh, it's too hard or it's too complex to really look at how this medication or that medication impacts women's bodies or is impacted and affected by women's hormones, all those other nebulous things?
Yeah, I think some of it is will just be, this is how we've always done it. This is the status quo. We know how to do this. We'll keep doing this. There's kind of the gold standard of randomized control trials. They know how to do them the way they do them now. So to change that requires effort and money. And there will also be people who are very considerate, but get a bit paralysed by, not wanting to get it wrong. And it is, like I've always wondered, how can we do the biological side of health research in a way that really includes all the different sex and gender options and differences that are there? Because we don't want the process of getting more women's health research to then mean that we have excluded and discriminated a whole lot of other people even more than they already are. So,
I can understand what you're saying there. It's very tricky, I think people are scared of getting it wrong, but I suppose from my perspective, looking at it, I'd rather someone make the effort and potentially get it wrong than not make the effort at all, which it sounds like is what people are doing, and what they're starting to do these days. So you've been working in this space for a while now. Have you seen any positive changes or trends since you first started?
It's how we learn, right? Yeah, there's definitely trends of better research coming through. Obviously, the current political state of the world may slow that down or change that, but there's definitely been some increases in that. And then obviously the project I'm part of, the fact that it got funding, that's a really positive sign to show that there's interest in improving research. There's a book come out of the UK about how people are unheard in the health system. So there's definitely more conversations. That might just be I'm more aware of them because I'm researching it, but I think there's definitely more conversations and thought happening.
You mentioned wanting to, or I suppose needing it to be enshrined in policy. So do you feel like there are people in the political sphere? I mean, I suppose you can only really talk from a New Zealand perspective more so than an Aussie one, but are there people out there championing this cause in legislation?
Yeah, I think so. I think, the cogs of politics just move really slowly. Not last year, the year before, New Zealand had quite a win. We had our first women health strategy in the health system come out. There's room for improvement there in how it feeds into the research system, but I definitely think things like that get more people talking and thinking about how we can improve it. We just need more people to throw more funding at the research side of things so that we can make some really good progress.
Yeah, of course. And, for people who are currently in that research space looking at medical research, what would be your advice to them to be more inclusive of women's voices and women's bodies in the research that they're doing?
To do it, basically. Women are really keen. They've had a bit of a hard time when it comes to research and to the health system for that matter. Like, there's a lot of distrust and uncertainty there, but when they're given a safe place to talk and to have a conversation about women's health and what they're interested in, what they want to know, there's so much information there, and they're so enthusiastic to be involved and so generous with their time and their knowledge. Just have to be really mindful and take a lot of care to make sure that that's a safe space for vulnerable conversations, and inclusive for whoever you're wanting to include in that work.
Yeah, of course. How can people make sure that it is a safe space? I feel like we talk a lot about what a safe space is, but how can we productively contribute to making somewhere a safe space, particularly in this medical research field?
Yeah, a lot of it, I think, relies on building relationships, and so particularly the research that I've been doing has underpinned by relationships. And so we weren't just going and having a one interview session with women. We had, it's been a couple of years worth of conversations and emails and things. So we've really built that relationship there with them so that they can trust us and open up. And there's lots of really little things that just get forgotten, like just choosing a venue that doesn't have connotations. People don't necessarily have good memories of schools. They might be uncertain about churches. Conference centres are a bit scary, and universities can be scary for a lot of people if they've not been. So choosing a place where it doesn't have a connotation or a memory or potentially, you're never going to get it 100% right. So it's just try your best. And then things like hospitality, cake, coffee. Those things make a real difference to how you have a conversation with someone, and what that space is. And so we had small groups of women, and they really trusted each other and shared some amazing and heartbreaking stories with each other and with us. And I really think it was a lot of those sort of little moments of care that make a difference.
Yeah, of course. And one of the things that you spoke about when I was reading your expert reaction to this study on Cymex is that the team that you're a part of has created this library of health-related research questions. Now, is this specific for Aotearoa, New Zealand, for those who are unsure? What are some of those research questions and how can researchers access them?
We're working on the access point of it currently and how we will make that available. Some of the questions are as big as what would a health service or health system that was designed by women for women look like? So just let's go really huge with some of those questions. Some of the others were, how might policy and systems design be developed and implemented in order to improve equity of access to healthcare? Access is obviously a huge issue everywhere for everybody as to how they can get their healthcare. We had some that were specific around improving health for wahine Māori in New Zealand. How can we design healthcare systems that women have agency and autonomy throughout? They were really big questions, actually.
Yeah, I think they're very important. You're expressing these questions to me and I'm going, why are these things that people haven't asked before? Why are they only being asked now?
And they are big from to research them is going to take a lot, obviously, but I think it is because they're so important, They would make a real difference to a lot of women, and probably more than just women if we improve the healthcare system.
I think improving the healthcare system for, you can't even call women a minority, 50% of the population is women, but the fact that we have to express women as part of the diversity and equity thing really shows, I guess, how much our system doesn't think of them. So I'm completely mind blown, but also sadly not surprised that these are questions that haven't been addressed before. I mean, the fact that they're being asked now, though, is, I think, really, really important. And hopefully for our listeners out there, if you are in the medical research space and you hear these questions, ask yourself, why hasn't anyone asked this before? Do you have any, I'm asking the big questions back to you now, do you have any potential hopes for what a healthcare system designed by women for women might look like, or policy-wise, what that takes into account?
I think that two things that from our conversations that would make a huge difference in healthcare systems is a continuity of care so that you're kind of looked after no matter what you're dealing with. And so particularly here to get seen in a good time frame, you often don't see the same GP each time, it'll be something different. And so you spend the first 5 or 10 minutes of your 15-minute appointment telling your history, particularly if you have a chronic health condition, which chronic health conditions are seriously under-researched and predominantly affect women. So that's a vicious cycle there. But also just, really listening and validating patients as the expert of their body and what's going on for them. I think that would make a huge difference to people's experience of accessing healthcare, and probably mean people access healthcare sooner rather than later, and so then you would be dealing with stuff when it's at a much more treatable time.
Yeah, what you're saying is it's echoing things that I've heard from so many different women, whether they've got chronic health conditions or not. So it's definitely something that I hope, again, like I said, our med students out there listening take into account. Lecturers, people working in the medical space, whether it be research or practicing, think about these things. Ask yourself, how do you do it in your practice, in your life, in your studies, and really, really focus on that. So I just want to say a big thank you to you, Anjali, for joining us. It's been a really interesting and really prominent and important conversation, and I'd love to go deeper in depth with you at some point. But before we wrap up, is there anything that I haven't thought to ask or have missed that you'd like to share or express?
No, I don't think so. Just, more research that includes more women. Yeah.
Yeah, thank you so much for joining us. I hope this was an absolute pleasure for you. It was an absolute pleasure to talk to you, and what you're doing is really powerful and really important, and I hope that it has opened some doors and some eyes for our listeners.
Thank you. It's been great.
You're listening to 106.9 TuneFM, connecting you and me to UNE here on the home of UNE's student-powered radio.